An infant has been diagnosed with microcephaly. Microcephaly. This is a medical condition in which the brain does not develop properly, resulting in a smaller than normal head. Doctors suspect that this brain disorder developed due to the fact that the mother had been taking actinomycin D during her pregnancy. What germinal layers have been affected by this teratogen? Okay, so let's look at it one after the other. Now, generally speaking, the ectoderm differentiates to form the nervous system. It differentiates to form the nervous system. The tooth, that's the enamel, and the epidermis, that is the outer part of integument. It also forms the lining of the mouth, the anus, nostrils, sweat glands, hair, and nails. That's basically the function of what ectoderm, or that's what it differentiates into. The mesoderm. The mesoderm differentiates to form the circulatory system, including the lungs, skeletal system, and the muscular system. Then we have the endoderm. Endoderm differentiates to form the digestive system, the liver, pancreas, and the inner lining of the lungs. So of course, I've already explained microcephaly. It has to do with brain tissues. So which one is the most appropriate answer? Of course, ectoderm. Ectoderm is your answer. Ectoderm. A patient demonstrates sharp decrease of pulmonary surfactant activity. So, decrease of what? Surfactant activity. Now, a pulmonary surfactant is just a mixture of lipids and proteins which is secreted into the alveolar space by epithelial type 2 cells or alveolocyte type 2 cells. Now, what's the function? The function of surfactant is to lower the surface tension at the interface, where that's the air and liquid interface within the alveoli of the lungs. So it is needed to lower the work of the breathing and to prevent alveolar collapse at end expiration. So what happens when this condition is taking place? It results in alveolar tendency to reside. Okay, that's what reside. Inability of the alveolar to come back to its normalcy, like there's a recoiling. So if it's not able to recoil, what happens? There will be collapse of the lungs. So basically, decrease of this surfactant activity leads to alveolar tendency to reside. So that is your answer. Okay. A patient is diagnosed with diabetic coma. Blood sugar is 18.44 millimole per liters. Now the normal range is about 3.5 to 5.5. So having 18 is of course extremely high. So what glucose regulating drug should be prescribed? Of course, it should be rapid acting. Otherwise the person can just die easily. It's rapid acting. So rapid acting is your answer. Okay, initial inoculation of water in 1% peptone water resulted in growth of a thin film on the medium surface in 6 hours. Such cultural properties are characteristic of causative agent of the following disease. So what do you think? 1% peptone water. Now for 1% of peptone water, that's actually alkaline water, usually vibrio cholera grows. So it is the best medium for vibrio cholera to develop or for it to grow. Cholera. because it's just a medium, the best medium for color to grow. An infant born prematurely 2 days ago present with yellow coloring of skin and mucosa. Yellow coloring of skin, of course, that should tell you there's what? Jaundice present. Now, such a condition in the infant is caused by the temporary deficiency of the following enzymes. Wow. Do you remember UDP? Yes. I've already explained UDP to you. It helps to prevent the breakdown of bilirubin. Okay. It has been determined that one of the pesticide component is sodium arsenate that blocks lipoic acid. It blocks lipoic acid. Now, enzyme activity can be impaired by this pesticide. Yes, of course. Name this enzyme. So the question now here is, what enzyme this sodium arsenate blocks that particular enzyme? So what enzyme could that be? Now, your answer is actually pyruvate dehydrogenase complex. Don't forget, this pyruvate dehydrogenase complex is actually made up of what? It's a complex, so it's made up of what? 3 different enzymes combined together. We have the E1, the E2, and E3. That's enzyme 1, enzyme 2, and enzyme 3. The E1 uses thymine pyrophosphate as its prosthetic group. That's the non-protein part of an enzyme. Prosthetic group means the non-protein part of an enzyme. Now, this sodium arsenate has an allosteric inhibition to TTP, that is the thymine pyrophosphate. So what happens? It will impair the function of this particular enzyme, pyruvate dehydrogenase complex, because the active site of this pyruvate dehydrogenase complex is actually the TTP, that is the thymine pyrophosphate. So your answer is, of course, this one. Okay. A 50-year-old woman diagnosed with cardiac infarction has been delivered into an intensive care ward. What enzyme will be the most active during the first 2 days? So these ones, the most appropriate answer is what? Aspartate. Aspartate. Aspartate is normally found in the liver, the heart, the skeletal muscles, the kidneys, the brain, red blood cells. So serum levels of AST level, ALT level, and their ratio are commonly measured clinically as biomarkers for liver health, usually for liver. But in this particular case, it's also for what? For the heart as well, for the heart. So myocardial infarction has to do with the heart. So the most appropriate answer is what? Aspartate aminotransferase. Now let me take the various function of the LDHs. Now, LDH1 and LDH2 is predominantly found in blood serum. Now, a high level of LAD1 and LAD2 suggests myocardial infarction. Myocardial infarction or myocardial infarction. Now, LADH3 is mostly found in the lungs, the lymph tissues, pancreas, and in the platelet. LADH4, liver, kidney, placenta, and then muscles. And then LADH5 in the liver and striated muscle. But over here, the most biomarker that you will use is aspartate. Aspartate aminotransferase. Don't forget, both aspartate and alanine is biomarkers for liver too. So take note. Stool culture test of a 6-month-old bottle-fed baby revealed a strand of intestinal rod-shaped bacteria of antigen structure 0111. What diagnosis can be made? Of course, your answer is cholenteritis. cholelentera. That is the structure. I don't know how to explain to you, but that is the antigenic structure of cholelenteritis. So you have to take note of it. 0, 1, 1, 1. Okay, next question. Parents of a sick 5-year-old girl visited a genetic consultation. Karyotype investigation revealed 46 chromosomes. One chromosome of the 15 pair was abnormally long, having a pair of the chromosome belonging to the 21st pair attached to it. What mutation occurred in this girl? Now, when we say inversion, that means the chromosome has turned. It has turned, maybe 360 degrees, I don't know, but it has completely turned. That's what inversion. So the head becomes tail and the tail becomes head. But that's not the case over here. Deletion. No, nothing has been deleted over here. It is still intact. Just that a portion has moved to the other side. Translocation. Of course, that is our answer, because translocation means it moves from one place to join the other part. Division, no. Duplication, no. Your answer is translocation. Translocation. Okay. A patient consulted a doctor with complaints of dyspnea occurring after physical exertion. Physical examination revealed anemia. Okay. Paraprotein was detected. This is what you're looking for. Paraprotein was detected among gamma globulins. What value should be determined in the patient's urine to confirm the diagnosis of myeloma? Myeloma. Of course, to diagnose myeloma, there must be what? Paraproteins. So what is used to determine paraprotein in urine? Your most probable answer is what? Ben-Jones protein. Ben-Jones protein. So that is your answer. That is the diagnostic tool that you will use. So Ben-Jones protein. A patient complaining of dizziness, thirst, difficult swallowing, and impaired vision of close objects has addressed a doctor. Objectively, respiratory rate is increased, pupils dilated, general agitation, talkativeness. Though the speech is indistinct, blood pressure is 110, 170 millimeter mercury. Heart rate is 110. Wow, that's high. Given symptoms can indicate overdose of the following drug. Overdose of the following drug. Now, okay. So which is your most closest answer? This you don't think too much. Your answer is atropine sulfate, because atropine sulfate is actually an anti-muscarinic agent which is used to treat bradycardia and of course reduce salivization. And over here, what do we have? The heart rate is 110. So that means an overdose of this thing has actually led to the increased heart rate. And of course, all these other ones also is a suggestive of the fact that it is atropine which has been overdosed. Now, morphine is actually an opioid pain medication. It's sometimes called narcotic. So, but overdose of it actually slows the breathing and then the heart rate. Overdose of morphine actually slows it down, not increase it. Overdose of caffeine actually leads to what? Restlessness, anxiety, excitement, insomnia, and so on and so forth. Now, aminazine is actually antipsychotic drug. Antipsychotic drug. So it has got nothing to actually do with what we are talking over here. So our most probable answer or closest answer is what I have just explained. Atropine. A dry cleaners worker has been found to have hepatic steatosis. Wow, that is liver disease, fatty liver. That is a lot of fat. Now, this pathology can be caused by the disruption of the synthesis of the following substance. Now, fatty liver, as I said, is just the buildup of what? Fat in the liver. Now, studies suggest that low level of PC, that is phosphatidylcholine, studies have shown that this play a major role in the pathogenesis of non-alcoholic steatohepatitis. We are yet to know the real mechanism. So our answer here is what? Phosphatidylcholine. A 35-year-old man with peptic ulcer disease has undergone atherectomy. After the surgery, now this means the antrum part of the stomach has actually been removed. After the surgical secretion of the following gastrointestinal hormone will be disrupted the most. Now, don't forget the part of the stomach. We have the cardiac, the fundus, we have the body, the antrum, and then the pyloric part. So when this antrum is removed, where actually we have most of the parietal cells, that's the antrum, that is the area between the body and the antrum. So the body and then the pyloric part of the stomach. When that place is removed, of course, we have a whole lot of parietal cells over there, and parietal cells is involved in the secretion of what? Gastrin. Now, this neurotensin, it has got nothing to do with intestine. It's not produced in the intestine. That's what I mean. Cholecystokinin actually is produced in the duodenum. But over here, the duodenum is intact. Secretin also in the duodenum. This is an immune reaction hormone or enzyme. So your answer here is what? Gastrin. A 16-year-old adolescent is diagnosed with hereditary UDP. Laboratory tests revealed hyperbilirubinemia caused mostly by increased blood content of the following substance. Now don't forget, UDP, our guy, UDP here, it prevents conjugation of bilirubin. It prevents the conjugation of what? Bilirubin. So when something is not conjugated, what do we have here? Of course, we'll have hyperbilirubinemia, but which one of them will be high? Is it unconjugated or conjugated? Of course, your answer is what? Unconjugated, because most of them will not be conjugated. So your answer is what? Unconjugated bilirubin. A 60-year-old patient with a long history of atherosclerosis and a previous myocardial infarction, this is your guy, developed an attack of retrosternal pain. 3 days later, the patient was hospitalized and then died of progressive cardiovascular insufficiency. Sorry for that. During autopsy, a white, fibrous, depressed area about 3 centimeters in diameter with clear margins was found within the area of the posterior wall of the left ventricle and interventricular septum. Wow, this one they've just given you a very big clue here. Very big clue here. With margins. See, white, fibrous, depressed area. That means what? Very focal. at a particular place. Which place? Posterior wall of the left ventricle and then the intraventricular septum. So the dissector considered these changes to be, of course, focal. I've already told you, this is a clue that it is what? A focal cardiosclerosis. Cardiosclerosis.